work to limit, not have visitation. All the staff members had to be screened thoroughly before being able to go to work. We required the wearing of PPE. We sent rapid response teams to go look at infection controls, assess needs, and report back. I've sent National Guard. I got 50 National Guard strike teams going to nursing homes, conducting surveillance testing so that we can identify clusters if they're there and limit them. And then my Secretary of Health Administration, she said from the very beginning to hospitals, you cannot send a COVID positive patient back into a nursing home that doesn't have the capacity to isolate with negative pressure, because when you do that, then it spreads like wildfire. So she did a really good job with that. And so what we're doing going forward is I'm going to be unveiling a mobile RV lab that we can drive across Florida. The results are going to come back in 45 minutes. So we're going to go to nursing homes is going to be our #1 thing, test the staff, test the residents, and eventually, Maria, once we get enough rapid tests, I'd like to be able to test the family members and let them go visit their loved ones. These people haven't had visitors for close to 2 months. That's not an easy thing. Obviously, we got to err on the side of safety. But if a son or daughter can get a test and they're negative, then they should be able to go in and see their parents.
The exception of 3 counties with the most COVID-19 cases. That's Miami-Dade, Broward, and Palm Beach. The executive order allowing some businesses, retail stores, and state parks to reopen tomorrow morning, but only at 25% capacity. Joining me right now to tell us how he's gearing up is Florida Governor Ron DeSantis. Governor, it's good to have you this morning. Thanks so much for being here.
Good morning. Thanks for having me.
What will tomorrow look like, sir?
Well, I think tomorrow is going to be a small step. I think it's going to be a measured step, but I think it's going to be an important step for people of Florida to know that there is a light at the end of the tunnel. We're going to follow a safe, smart, step-by-step approach to Florida's recovery. We're going to follow data and facts, but we are intent on moving forward to be able to get the society on its feet again. Florida, we were doing so well before this pandemic hit. Our unemployment rate was 2.8%. We're having businesses come left and right. Our coffers were overflowing, even though we have very low taxes. And I think we can get back there. It's not going to be like turning an on and off switch, but I think tomorrow will be an important first step. I think it's also important to point out to folks the way Florida has approached this, even though our hospitalization and infection and fatality rates are much lower than many of these other big states, particularly in the Northeast and Midwest, we did not necessarily, quote, shut everything down. I had construction going. We had a lot of retail that was open. I actually accelerated road projects because the traffic was down. So places like Orlando, Tampa, Miami, we accelerated and surged workers, and we're able to knock out a whole bunch of stuff in a very short period of time. That's going to be, I think, very good going forward. So we're starting, I think, a little ahead of where some other states are. So I think that'll help us as well.
And at the same time, you were hit with massive amounts of unemployment benefits. Things changed in a couple of weeks from that very strong economy. Disney, one of the most important businesses in your state, closing down, furloughing 75,000 employees. Universal the same. Do you think those workers will actually come back at some point? You think Disney will rehire those people?
No, I think that's the plan. Yeah, look, this is a temporary closure. I think they've already been making great plans to come back safe. It's interesting. These parks were open all the way through the middle of March, and they were doing, it was under the radar. A lot of people don't know, but they were doing ridiculous safety precautions. I mean, it was so well thought out. And to this day, we really haven't been able to tie any outbreaks back to those theme parks. So I think they were really concerned about safety. I think they have even better ideas. So I think that they will come online. It's not going to be phase 1, but I think it will be something that happens. And I think you're going to see a lot of new innovations just to give people the confidence that it's a safe thing to do.
Many people's parents, grandparents are in Florida at nursing homes, Governor. I want to ask you what you're doing there because we've seen a real disaster in terms of the nursing homes in New York. How are you going to avoid what has taken place there? What have you already done in terms of nursing homes in Florida?
Well, those were the first actions we took in March because we knew that this was a virus that affected elderly much more severely than people who were younger, particularly people under 50 who with no conditions. So we immediately worked to not have visitation. All the staff members had to be screened thoroughly before being able to go to work. We required the wearing of PPE. We sent rapid response teams to go look at infection controls, assess needs, and report back. I've sent National Guard. I got 50 National Guard strike teams going to nursing homes, conducting surveillance testing so that we can identify clusters if they're there and limit them. And then my Secretary of Health Administration, she said from the very beginning to hospitals, you cannot send a COVID positive patient back into a nursing home that doesn't have the capacity to isolate with negative pressure.
Performing well before COVID hit. So we don't know what's going on in those nursing homes.
And today, Governor Cuomo announced a probe of the state's 600-plus nursing facilities.
We're going to undertake an investigation of nursing homes now to make sure they're following the rules.
But one rule has arguably made operating nursing homes tougher at a very difficult time. A March 25th state health department directive says nursing homes shall not deny readmission or admission based on a confirmed or suspected diagnosis of COVID-19. The order even prevents a nursing home from asking for a COVID test for someone applying for admission. The idea behind this rule was to free up acute care hospital beds by moving recovering COVID patients somewhere. For state government, somewhere is nursing homes. This rule, a big concern for Catholic.
Circle back to Mr. Cuomo. Mr. Cuomo, you put out a policy on March 25th. Nursing home administrators, directors of nursing, and hospital discharge planners, despite the fact that we had enough data to know that frail senior citizens in nursing homes, in assisted living homes, and senior facilities are the #1 potential death target of this virus. You sent coronavirus positive individuals into nursing homes, and now you're blaming the nursing homes. Here it is. Here's your order right here. It says no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. Nursing homes, listen, America, are prohibited from requiring a hospitalized resident who is determined medically stable to be tested for COVID-19 prior to admission or readmission. The next day, the nursing homes and their association begged the governor, please don't do this. We can't handle these people. We have senior, frail residents in here. And what does he say? He doesn't care. In fact, the title in the Wall Street Journal that day was, New York mandates nursing homes take COVID-19 patients. What kind of an idiot do you have to be to take COVID-19 positive patients out of hospitals and put them with frail senior citizens in nursing homes? They're not set up for that. That guy, honestly, has blood on his hands and a big mouth to boot. Now, the Florida governor, he says, hey, the data shows nursing homes are a problem. Assisted living homes are a problem. What does he do? He moves his medical resources into those areas to try and protect those people. Yes, Sean.
25% of deaths in New York, and he had the Navy ship and the Javits Center COVID-19 ready, and they didn't use it. That makes it worse. Mark Levin, great one. Exactly. Every Sunday night, 8 p.m.
Also, the rule mandating admission of COVID patients at nursing homes is not something the governor seems interested in discussing. Consider this reporter question from today's COVID briefing.
Did any nursing homes object to, one, this policy, and two...
They don't have the right to object. That is the rule, and that is the regulation.
Because when you do that, then it spreads like wildfire. So she did a really good job with that. And so what we're doing going forward is I'm going to be unveiling a mobile RV lab that we can drive across Florida. The results are going to come back in 45 minutes. So we're going to go to nursing homes. Is going to be our #1 thing. Test the staff, test the residents, and eventually, Maria, once we get enough rapid tests, I'd like to be able to test the family members and let them go visit their loved ones. These people haven't had visitors for close to 2 months. That's not an easy thing. Obviously, we got to err on the side of safety. But if a son or daughter can get a test and they're negative, then they should be able to go in and see their parents.